Good day, S4OM community. Welcome to Conversations with the Oncology Care Team, a webinar series sponsored by the Society for Oncology Massage and the Society for Oncology Aesthetics. Our goal is to provide information to help massage therapists and estheticians support their growth as practitioners with enhanced knowledge of current oncology options. My name is Erica Clinton, and I will serve as the moderator for our dialogue today with Susan Yaguda. Susan is the manager of Integrative Oncology, Survivorship, and Senior Oncology at the Levine Cancer Institute in Charlotte, North Carolina. In her department, this includes massage, music, art, healing touch, acupuncture, and more. She has a wide range of experience, and I'm sure will provide an array of information for us to discuss today. Thank you so much, Susan, for taking the time to join us.
Thank you for having me.
I know that one of our wonderful regional champions, Melanie Lanice, works with you. So we're going to talk a little bit about massage as well. And you can, of course, give Melanie lots of props when we talk about that.
That's easy to do.
Wonderful. But just to kind of help our practitioners understand your work, can we start off with an explanation of what you do as a manager of integrative medicine in a hospital setting?
Sure. And that's a great question. I kind of wear many hats. So I am a registered nurse, a master's prepared registered nurse. And so I bring with my background and training a very clinical eye on things, but I also bring that person-centeredness to the work that we do. And so my role really has many buckets. And in starting our integrative program, it was really to look at the clinical impact that we can make within our institution for people diagnosed with cancer, and to kind of sell that as a safe, not only safe, but also effective intervention to our more conventional oncology providers. And then around that, to really develop standard operating procedures, to develop ways that we're assessing the impact of the work that we're doing by patient-reported outcomes, patient-reported symptoms. And then also to do all the things that need to be done within a medical facility around infection prevention, around compliance and privacy and safety, so that the massage therapists that come in can feel just very confident that they're operating within those parameters, and that we're keeping not only our patients safe, but we're also keeping them safe as well within the context of that, of working within the institution. I also want to keep my team engaged. So how can we keep them excited about the work that they're doing and share best practices amongst the team? We oftentimes have a journal club that we will share something that is, maybe an article of significance for the team. And then, we all kind of learn from one another. We also, through that process, learn how to both co-treat and collaborate on patient care, but also what makes a good referral. So what would make a good referral for somebody who's being seen in acupuncture or yoga, for example, to oncology massage, and just having just a general better understanding of what each specialist brings to the table of patient care within that integrative setting.
Wow. That's a lot.
It's a lot.
But it's so interesting because I feel like it takes into account your nursing background, which gives you that clinical aspect. But then there's this very human piece.
Mm-hmm.
And although as the manager, I'm sure people are like, wow, you're like the administrative person, but you're really kind of like the heart of the integrative medicine approach. And you make sure that the practitioners understand their responsibility to the patients, to each other, with, I guess, a common mindset about why people are using integrative medicine or the value of it. And then, of course, obviously the statistics,
Mhm.
right? The
Mhm.
outcomes, and making sure that there is proof that the integrative approach is a positive and effective one.
Right, right. All of those things. And, integrative medicine, particularly within the context of cancer care, is still, I wouldn't say it's infancy, but toddlerhood maybe.
Hmm.
And so when we look at the level of evidence, we always also look at the level of risk. And so, certainly with a lot of oncology interventions in the conventional world, they can be very, very effective, fortunately, but they also do carry a fair amount of risk sometimes. And so when we look at that balance with integrative interventions, oftentimes the level of risk is pretty low. And so in doing that, we can also, I don't want to say function off of no level of evidence, but you know, we're not we're not a team that gets a lot of funding for research from the pharmaceutical industry, for example. And so a lot of the work that we do is very grassroots and looking at, whether it is those patient reported outcomes, which I think are still very valid tools to use, but also we don't have quite as high of a bar to cross, in my opinion, with
Hmm.
regard to evidence because of the lower risk. And so I often will refer to a lot of the work we're doing as evidence informed. And that means that, we're seeing positive outcomes from this. It may not be, a double blinded randomized trial, but we're
Right.
still, that evidence does support the work that we're doing.
Now, at Levine Cancer Center, your position appears with its focus in obviously oncology, but
Mhm.
even a separate category of senior oncology and survivorship. Why are those three things so specifically mentioned for your role?
Yeah, so those are sections within the Department of Supportive Oncology. So I think about the Department of Supportive Oncology as an umbrella department. And within that, we have kind of different sections. We're all looking at providing supportive care. So we don't give chemotherapy, to our patients or, perform surgery or give radiation therapy, but we're really looking at how can we best support people through all of that and beyond. And so, integrative definitely has a role. And then survivorship, we oftentimes think of survivorship as after treatment is done. However, we're really seeing survivors sooner, which is something that I love because we can partner with them earlier in the game to provide them with, good standards of practice with regard to screenings, good genetic screening opportunities that they may be able to do or their family members may be able to do. How can they reduce the risk of recurrence? How can they reduce the incidence of long-term or lingering side effects from cancer or cancer treatment? And so the sooner we kind of get them engaged in that, it's very empowering to patients to be able to say that they can do these things to help their own well-being along the way. And then senior oncology, our seniors are the fastest growing population diagnosed with cancer. We're living longer, and it's kind of a cancer is kind of a disease of aging in part. And yet, older patients often come to us with many other comorbidities that become complex. They also sometimes come to us having been medications that sometimes come from multiple prescribers. And so we have that concern. They may be frail and at risk of falling, which is also a concern. And also, as we age, we really need to better understand from our older adults coming to us what matters to them. And so we talk about in senior oncology, we are level 2 designated from the Institute for Healthcare Improvement as age friendly. And we circle around what we call the four M's, which is mobility, mentation. How are we working cognitively? Medications, and then what matters. And to me, that's really the heart of what we're doing with regard to informed decision making, helping people kind of make those decisions, knowing what's important to them at that stage in their life. When you look at integrative oncology, it kind of weaves into all of the sections within my department. So the other section is palliative medicine, which is really just looking at symptom management from more of a medical lens. They often will reach out to us to co-treat cancer rehab. That team will often co-treat with, especially massage therapy, to assist with either, lymphedema management or range of motion issues that somebody may be having from scar tissue or that type of thing. So it's kind of a nice big family, then that we know we can reach out to colleagues from a different section within the department and, get some help us a specific need in a patient.
Oh, that's wonderful. That's wonderful. So you've been in healthcare for a number of years. What do you find to be the most challenging part of working in healthcare?
Well, I mean, we were experiencing a nursing crisis before the pandemic. And so you have to have been living under a rock for the past 4 years to, not realize that we continue with that crisis. And it's not just nursing, it's physicians, it's everybody that's been involved in healthcare. They're
Mhm.
really feeling kind of the repercussions of, several tough years, particularly. I think also sometimes the political climate influences, working in healthcare, and that healthcare providers, we want to provide care. And so sometimes when you have all of these social determinants of health hoops to jump through in order to get care for our patients, it can be really, really challenging to kind of press forward and try to get what the patient needs under a very complex reimbursement system with multiple levels and access to care is really challenging too. The good thing I think is that the people that I work with, we just really, really care very much about how can we best serve those that have come to us in need. And that level of commitment has really been uplifting, I think, certainly for me as a manager, but also something that we can share across our team to sort of help us all feel a little bit bolstered going through some of these tougher times.
Yes. The last few years have been quite different in healthcare than I think any other time in our history in a long time.
Yeah, for sure.
And we're still trying to recover from all that.
Yeah, yeah.
So let's look at something positive. What do you find to be the most rewarding part of working in healthcare?
Well, I love working where I'm working now because it is a very multidisciplinary team approach. And so, from the integrative section, for example, everybody brings their specialty. So, we have, our oncology massage therapists, and they, have that additional training and they can kind of see things in our patients that they may benefit from. The music therapist, our music therapist, the same thing. They, add their own flavor to the mix of how we can best help our patients. And so I really love the collaboration across the team, the appreciation for one another and what everybody brings to patient care. The other thing that we've been able to do that I think is really important is cancer doesn't just impact the person who gets the cancer diagnosis. So, we know that it impacts their family, it impacts their work colleagues, it impacts all levels of their lives. Some of our patients have young families and they're trying to work and also be, an active, involved parent while undergoing cancer treatment. And so our team also provides services that can help benefit the care partner, whoever that may be for a patient. And I think that's really important. And then the last little bit of that has been really rewarding is we have, as a team, supported our colleagues. So we started doing that we've always been doing that, but we started doing it much more intentionally during the pandemic when we knew that our colleagues, especially frontline workers, were really, distressed. But it's been something that has been maybe even more important now as people are really processing that experience of the pandemic and trying to kind of, get back to the heart of healthcare that drew them to the field to begin with. And so the massage therapist, for example, will, if they have like a unexpected block of time that's opened up, they will go into a clinic and provide chair massages for people, invite somebody into the massage therapy room for a little treatment as well. And the other team members do that too, which has just been, again, a great way for us to support our colleagues, but also a great way to spread the word about the services that we
Right.
provide. Like, if you can experience a massage firsthand from one of our massage therapists, then you're going to be more likely to remember that and to advocate for your patients to get connected to that level of care.
Yeah. That's awesome.
Yeah.
That's awesome. And I'm sure everyone appreciates the generosity of integrative care because working in healthcare is challenging. It's
Yeah.
rewarding, but also very challenging.
Hmm.
So when you refer patients for oncology massage, what are you usually referring them for, or what are the goals they're usually trying to seek with body work? And can you share any positive outcomes that you've had?
Yeah, sure. So most prevalent is anxiety and stress. Our patients are just trying to grapple with a lot, not just a cancer diagnosis, but how is that going to impact everything else in their lives? And so having that time to step aside and spend in a self-care practice with a massage therapist has been really beneficial for them. And we have seen, just when patients rate on a Likert scale, reductions in stress and anxiety, from pre to post massage therapy. Pain is another common reason for referring to massage therapy. Oftentimes, again, it's not like we're taking the place of appropriate medication use, but we can be an adjuvant therapy for that and really assist in getting a higher level of pain relief for patients. We have patients who are sometimes on hormone therapy, which causes kind of that muscle joint pain. Massage therapy has been really helpful for that. We have even had patients with neuropathy say that their massage therapy improved their neuropathy. And, a lot of cancer treatments can unfortunately cause that neurotoxicity and neuropathy. And so, if we can get them some benefit from that, it really improves a lot of things in their lives, not just the pain of neuropathy or the discomfort of neuropathy, but also reducing falls because they can, feel their feet better or being able to button their shirt, that type of thing. So that's been really rewarding to see as well. Range of motion, like I had mentioned before, oftentimes the massage therapist will co-treat with the cancer rehab team and really work on very specific range of motion goals, whether it's person with scar tissue or some freezing that has happened over time. They can be helpful in that intervention as well, and just again add another layer of care for our patients. So that's been really beneficial. Also, lymphedema. And
Mm,
so we have lymphedema specialists within cancer rehab. Some of our massage therapists are also trained in lymphedema management, and so they can kind of co-treat that. The One of the issues that comes up with rehab services is that patients have a limited sometimes amount of coverage for those services, and yet there's still some concerns. And so we can co-treat and help support them through that, kind of stretch that out a little bit longer to get better outcomes.
that's wonderful. And I bet you have to be one of the people who has to think about all those creative ways to get access to care that people need,
Mhm.
particularly where health insurance may not be as available. So, in terms of you know, looking at the integrative approach that you work in, it seems like collaboration is kind of the key focus in the support that you can offer cancer patients. As a clinical practitioner, are there ways or I guess methods of collaboration that we could all embark on that would allow us to support patients better?
So I think better understanding what each individual, each professional brings to the table is key to encouraging collaborations. And so we've done that in a few different ways. Even across our department of supportive oncology, we'll do grand round presentations for the department. And a lot of people outside of our department will join those grand rounds. And so every section is assigned a certain number of times a year to be responsible for grand rounds. And so we can present on something around, like, for example, the care that we give in integrative oncology, whether it's acupuncture or massage or, music therapy or anything. And it's educational for our other providers who are attending. And they're going to think a little bit more about, oh, this patient would be good for oncology massage. I'm going to reach out to them and refer. So that's one way. From a nursing perspective, we also created a nurse champion program, a supportive oncology nurse champion program, so that in other clinics, there is a nurse who serves as kind of that conduit of information between supportive oncology and their particular clinic, whether it's the GYN oncology clinic or the GI oncology clinic or breast. They can bring that information to their teams. They do huddle presentations. They are kind of that go-to person for, I have this person that might benefit from, for example, massage. I'm not sure how to refer. And so the nurse champion in that clinic can kind of be that go-to person of information and advocacy for that. We also have interdisciplinary team meetings where we'll discuss a specific need of a patient from a very multidisciplinary perspective. And oftentimes that's a place to consider other ways that we can help out. And then I tend to go to some of the tumor boards as well and just be kind of listen in, hear what people are saying, hear what the needs and challenges are that in the case that they're presenting, and think about ways that my team can possibly assist and make that connection then. And sometimes that's just, the oncologist hadn't thought about that as an opportunity or something of that nature.
No, that's great. And it feels like you guys are really kind of thinking as broadly as possible, right? Filling the
Mm-hmm.
needs, providing whatever support so that, again, there is just more therapeutic intervention for people dealing with cancer.
Yeah. Yeah.
That's amazing. That's amazing. So I have one additional question, and it's just out of my own curiosity because you're the manager of integrative care. Have you had any experiences with an oncology trained esthetician?
So we haven't within our department. We have had opportunities for patients to work with an oncology trained esthetician through community connections. And so not even within our own institution, but through our outreach services department have done that. So
That's great. No,
yeah.
that's great. It's kind of been this really interesting engagement that we've had now that we're adding this group of oncology estheticians to our community to understand. And as we all know, as massage therapists, that skin
Mm-hmm.
becomes one of the areas that is so challenged by conventional cancer care. And so having this wonderful group of trained estheticians is really amazing for our group. And I think we're going to all learn a lot from each other.
Yeah, I
So
bet. I
very
bet.
good. Well,
Yeah.
thank you so much, Susan. I appreciate all the information you shared with us. It's been really wonderful to talk to you. And just huge thank you from S4OM and from Melanie for
I
your time
need
today.
Well, thank you, Erica, for having me. Thank you for the work that you're doing. And I so appreciate Melanie's work with S4OM and her advocacy. She is just a powerhouse here, and we all learned so much from her. So, much appreciated. I'm glad she was able to make this connection for us.
Yes, yes. I hope that you have enjoyed our podcast and that you have a great day. And we'll be seeing you soon.